I'm the Director of Clinical Training here at California Southern University, and I come in with a wide variety of experience in working with college students in a college counseling facility to working with trauma survivors, specifically domestic violence survivors, but also FBI detainees and other trauma survivors. Since the time of 9/11, racial prejudice survivors, etc. And I bring in all that experience to help students here at CalSouthern flesh through their own clinical experiences in practicum and internship courses. We have a lot of students who have years of experience as counselors and who want to get further specialized education in their fields. We also have students who are looking at a career change at some point in their life, stepping into this arena for the first time. Here at California Southern University, for our practicum and internship courses, we offer a web conference that occurs bi-weekly and is available to all the students in these courses for them to interact with and engage with their peers and look at cases and situations that their peers are facing in different parts of the world, to come together to offer some feedback, appreciation, and or problem solving together to find better solutions and to further the cause of therapy and healing. There's a huge diversity in experience, and it is also geographically based, but it is also site specific. So for example, we have students who are working in a church setting versus a school setting versus a clinical setting, an outpatient facility, a drug rehab setting, a substance abuse or domestic violence setting, what have you. So we have a wide range of clinical settings that our students come from, and this is a great online forum, the web conference, for students to hear about and learn about each other's specific specialty in the work that they do, and also give feedback and interact. I had a learner from Egypt who was, I think, in her late 20s. I also had in the same conference a learner from the East Coast who was in her 70s, and that just represents the range of learners that we see in these conferences. And the beauty of this interaction is that there is no ageism, and it is not about mentoring, but it's about interacting and sharing experiences. And I find that that's the energy of the conference, and I find that learners come in with that goal of really sharing a piece of themselves and a piece of their experience. Lately, we've been sort of starting them up with a round of sharing of something, sort of like an icebreaker, but not really. It has a clinical basis, the sharing that we do. I find that the conferences have a life and an energy of their own, and they are very interactive. The areas that I'm very watchful about is privacy of clients whose cases are being discussed, and so we leave out any identifying information. Also, any reportable situations involving child abuse or elder abuse or what have you are areas that I monitor really well. Other than that, it's kind of in the same vein as therapy. It has a life of its own, and it's not entirely describable in talking. It's more experiential, so I would invite learners to come and experience it. One of the biggest benefits of this forum and offering it in this manner to our learners is that it provides for a safe, non-judgmental space where they don't have their supervisors or their advisors or their mentors listening to the case discussion, and so there is some lowering of anxiety, performance anxiety, or fear related to the interventions they may have used in their cases. So I think that is one of the biggest benefits. I've had learners tell me this is their favorite part of the program, or also that this is their favorite part of practicum. They don't feel the pressure that they feel in formal supervision, and yet they get some of the same benefits that they would in formal supervision, where they are answerable to their supervisors. We also discuss the cases without any identifying information, whereas supervisors have access to identifying information. So it's sort of an oasis or a bubble, if you will, which is perfectly safe, and it provides the space for learners to discuss their cases. At the same time, I think it's very essential because they don't have that peer-to-peer interaction, and so for an online university to be able to offer this as an additional tool to their practicum experience, I think is very important.